Okay, I know I haven't posted for a while. Yeah, there's a lot kind of going on. I've actually started studying again. So I keep getting distracted by that. I'm studying online, so yeah. I'm actually studying things like I'm studying inner child healing and mental health in children. The aim at the end of all of this is to then do an actual 3-year course and become a mental health become a mental health nurse eventually. So yeah, that's the kind of end goal. It's going to take me a while to get there, but you know, I need a more fulfilling career. Mental health is where I shine. It's where I'm drawn, and it's what I want to do. So yeah, that's kind of been taking up time, so I haven't posted as much. So yeah. Anyway, done all that. I still will post, but obviously it won't be as often. I will try and keep it as sort of every sort of couple of weeks if I can. I don't kind of want to go over that if I don't have to. I know this one has slightly, but if I can try and keep it every couple of weeks, I will. So, yeah. Bell's palsy. I was actually really interested in this one. Bell's palsy isn't one I've heard of. It's one that I found actually while I was looking at other things. I found it quite interesting because it resembles a stroke in certain aspects. But yeah, so Bell's palsy is actually classed as an acute peripheral facial palsy, which is all to do with your nerves in your face. It's where they like droop. And it's only found on one side of the face. Now, when I was looking for information about this, I kind of went all over the place, and a lot of the information is a bit kind of scattered. So yeah, I did try and sort of compress it and put it all in some kind of order, but I think I messed up somewhere. But anyway, yeah, so Bell's palsy is where one side of your face just droops. It can resemble a stroke. It is neurological, and it is to do with the sides, the nerves in your face. This, although they're not 100% certain of any causes, it's a bit like any other condition. The causes aren't always accurate, but this can be brought on by a lot of viral infections. They found that it can be triggered by viral infections or strokes in general, or things like that. So things like cold sores, chickenpox, shingles, Epstein-Barr, you know, respiratory infections, German measles, mumps, flus, and even hand, foot, and mouth. They're all things that can cause, or they found can cause, Bell's palsy to be triggered in people. It can affect anybody. It is not like one of those conditions that only affects certain genders or certain ethnicities. It affects everybody, and it's so common that it can affect 1 in 60 people. It isn't that serious as a rule. It's actually not that serious as a condition, but there is a but. There are a lot of risks to it. There are some risks to this, especially if you're pregnant, in your 3rd trimester, or even if you've just given birth. It can actually have a knock-on effect to your health. So again, so people who are pregnant or heavily pregnant or just given birth, it can have a knock-on effect to your health. People who have colds or flus, diabetes, high blood pressure, it has a knock-on effect. It doesn't cause a lot of issues, but it can just have that kind of knock-on effect that just isn't very nice to deal with. Again, it does resemble a stroke. So, while looking up all of this, it does tell you that because of what it is and how it resembles so closely a stroke, you have to be very much aware of what the signs of strokes are so that you can be aware of what you're looking at. So as part of the symptoms of what you'll see with Bell's palsy, you might see things like this as well. So you're looking at signs of stroke. Things like one-sided weakness or paralysis on one side of your face. Aphasia, which is difficulty speaking or loss of speech. Loss of muscle control on one side of your face. A sudden loss of one or more of your senses, and we're talking like touch, on one side, your taste, your smell, your sight, blurred or double vision, and obviously things like loss of coordination or clumsiness comes with stroke as well because it affects your whole body. Bell's palsy only affects your face. Dizziness, nausea, and vomiting. Okay. And of course, a lot of other things that you get with stroke are things like stiffness in your neck, and then you can get emotional stabilities and personality changes, memory losses, headaches, and seizures. They all happen during strokes and can, okay? Massive issue. Stroke is serious, and if any of these symptoms happen to you at all, you need to you need immediate medical attention. It's just no ifs, buts and maybes. You do need immediate medical attention. Just to be on the safe side, because if you are having a stroke, you need help. But with Bell's palsy, one of the biggest symptoms that you will find is that it's a one-sided facial paralysis where one side of your face will just droop. And that's not just talking like your eye to your eye. They're talking like your eye, even from your forehead down. It will just droop. You're looking at symptoms like drooling, difficulty speaking, eating and drinking, dry eyes, facial or ear pain, headaches, a loss of taste, specifically a loss of taste, tinnitus, and if you don't know what tinnitus is, it is a ringing in your ear. It is exceptionally common. A lot of people have tinnitus normally. It is exceptionally common for a lot of people to just have tinnitus on a regular basis. Some people have it randomly. Some people have it constantly. It's exceptionally normal to get tinnitus. It's common. But it is one of the symptoms of Bell's palsy, along with all of these, and things like a sound sensitivity. Again, some of these do resemble stroke, which make it really difficult to know when and if it's a Bell's palsy symptom or if it's not. But there are actually early warning signs, which are weird because there's only like a couple of early warning signs, but they are there. You don't generally get a warning with stroke. Stroke kind of just happens. It's sudden and it just happens. With Bell's palsy, you cannot stop it, and you can't do anything about it in any way, shape, or form. But there are warning signs before the facial paralysis kicks in and any other facial signs or any of the other symptoms kick in. You will get a slight fever. You will get a slight fever and pain behind the ear. Not in the ear or on the ear, behind the ear. They are warning you that something's off. you're going to get this. You can't stop it. If the weird thing about this is that this resembles, the information on this kind of repeated itself a bit. And kind of said the same thing as well over and over again. So although I don't think this video is going to be that long, it is kind of important, I think, because of how similar this is, especially to what we're looking at. The Bell's palsy isn't serious, stroke is, but the symptoms that you will feel in your face resemble stroke. So you will need to kind of look, see a doctor regardless. When you see a doctor, when you start getting any of these symptoms at all, they can actually diagnose you pretty quickly, pretty easily through your symptoms, a history of all your symptoms, and a physical alone. And what they'll do is a physical of, whether or not you have a weakness in your forehead, which is really strange, but it is. It's the weakness in your face that determines whether or not you have Bell's palsy. But they will sometimes try to rule out other conditions, just to be on the safe side. So they could send you for a blood test to rule out things like Lyme disease, or a EMG to rule out, to check for nerve activity or damage, or an MRI or CT to rule out stroke. And they might even suggest you go for a lumbar puncture, which is a spinal tap, to check for meningitis, which is extremely bizarre, but they do it. That is just to rule out that they've actually got the correct diagnosis and to make sure there's nothing underlying going on. Because as a rule, Bell's palsy can actually improve on its own without treatment at all. It can take several months. The one thing about Bell's palsy is that symptoms can come on, and it can take from a few weeks to a few months for it to just sort of recover. And sometimes it corrects itself without any form of treatment at all. But if it's more severe and it's taking a little bit longer than normal to correct itself, there are things that they can do to help it and to make it easier. So things for eye care especially, they'll give you things like eye drops, and if the eyelid won't close, which is possible, obviously with Bell's palsy when everything droops, sometimes the eyelids don't close. If that happens, they will give you an eye patch to protect the corneas and from any damage, and to stop the eye from drying out. So you'll get eye drops and an eye patch to protect your eyes. They can actually help with the facial paralysis and help regain the movement with cortisol steroids, to decrease the swelling and help to just regain some of that movement in the muscles, in the nerves, in your face. There are things they do if it's extremely severe. They don't like doing it purely because they don't generally work for Bell's palsy, but sometimes they don't. They think that there's no other options, so they'll give you things like antiviral meds. Bell's palsy doesn't really respond to these kind of medications unless it's really severe. If you've had a really severe attack of Bell's palsy and it's not correcting itself, then and only then will they prescribe antiviral meds, because they don't generally help this condition. But they will do it. And one thing that they have done in the past is do electrical stimulation on your face. They're not really sure it helps. They're just not 100% sure it helps. But there are some that actually believe, there are some medical professionals that actually do believe that it helps to stimulate the muscles in your face after a Bell's palsy attack. They're not sure how well it works. They're not sure if it really does anything, but it's something they do try on the odd occasion. And on the rarest of occasions, very rare occasions, they will perform a functional facial plastic surgery. But it has to be on the most severe of cases, when the face has drooped so severely that it, after several months, I'm assuming it has to be so severe that it is actually affecting somebody's life, and it's not correcting itself, and it's not doing anything, and it's not going away. Then and only then will they perform this procedure, because it is a rare thing for them to do, because it is something that can correct itself without any intervention as a rule. But yeah, generally as a rule, 80% of people who have Bell's palsy recover from it, completely recover from it. But there is 5 to 10% of people that have had this once, who then have it reoccur later on in life. So Bell's palsy typically affects people about 40 years of age. It can affect them from the age of 15 anyway. From the age of 15 it can affect you. But generally as a rule doesn't manifest till about 40. They don't know why, but it does, right? But out of everybody that's ever had it, it's only been about 5 to 10% of people that have ever had a reoccurrence of it. And that's generally much later on in life. Much later on in life. So, yeah. But if you have a reoccurrence, or if you don't have an attack until sort of later in life, so if you're sort of 50, 60 plus, it can take longer for you to recover. It makes the risks a little higher, because it takes longer to recover from it, and it means that they generally need to do more interventions to try and help it. And the chances are that you might not recover from the attack, which is, not something they ever really want. I think that's the highest risk they have for the older people that have attacks, is that the general risk is they might not recover from it, and they need a lot more help in recovering from it. But again, it is one of those conditions that, although it is really simple to understand, it affects your face, and it looks like a stroke. It's exceptionally simple to understand. It affects your face and it looks like a stroke. Makes the whole of one side of your face droop and gives you facial paralysis. That is what it does. But it is triggered by other conditions. It is triggered by viral infections as a rule. And that is where the problem lies, because it then isn't a condition generally on its own. That's why doctors like to be able to make sure that the infections are all under control to help you recover from the attack. It makes it harder because depending on what infection caused the attack depends on how quickly the recovery comes. Yeah. So, yeah. At least that's what I found, anyway. And the older you are when you get an attack, the longer it takes to recover, and the more help you need in recovery. I think for people who have these attacks, I think it's more embarrassing than anything else, because they go out and about and their face is like one side is drooped. And society is very sort of critical of people who look different. You know, they still haven't got to that point where it's okay if you look different. You know, if one side of your face is like drooping and fallen, they will look at you funny and they will make you feel uncomfortable, because people do. You know, it's a sad world that we live in when that happens. We're in 2023 and people still behave like that in society. But they do. And that is the worst part about this condition. It's not the fact that it happens, and it's simple to diagnose, and it's easy to and it's extremely common. It's the fact that for people who have it, the recovery process will make them uncomfortable every time they walk out their front door. Because society will make them feel uncomfortable. Anyway, I'm going to go, and I shall see you all later.